Good morning, sir.
Good morning, Arvind Radhakrishnan. How are
Yes,
you?
I'm fine, sir. How are you, sir?
All fine, all fine.
Yes, sir.
Looking good, healthy.
Thank you, sir.
Okay. You have put up a lot of weight from last time or
No,
only
sir.
weight? Slim.
No, sir. I've been the similar weight only, sir. I've just cut my hair a bit short, sir.
Oh, yeah, the different
Yes, yes.
hairstyle. Okay. So, see, you have been to many of the interactions, right?
Yes, sir.
We were discussing some case and things about you. So, we end up reaching two main points
Yes, sir.
with regard to your deaf.
Yes, sir.
One is the optional, the kind of profession that you have,
Yes, sir.
and second thing is about the hobbies part and the kind of activities that you have taken and participated in.
Yes, sir.
So, to begin with, Arvind Radhakrishnan, because many of these areas that you are familiar with, we will be asking your experience as far as the optional that you have taken
Yes, sir.
and the kind of performance in the optional paper, as well as the profession that you had in your life, the
Yes,
practical aspects. To
yes,
what extent the practical aspects about your profession has helped in performing well in your optional papers.
yes, sir.
So, if I can put this question that way, that can
Yes.
you update about the practical experiences that have benefited you while writing the answers for the optional papers?
Yes, sir. Sir, so basically, medicine per se, both the NMC guidelines and the UPSC's medical sciences optional paper is more of a practical oriented paper, sir. Always when they test the theory knowledge in medicine, it is always based on the practical experiences we gather rather than just rote memory and textbook knowledge, sir. Uh, while yes, the risk factors, etiologies of the disease, that is the initial part of the answer, might be based from the textbook. Apart from that, the treatment aspects and what we have experienced while treating, for example, sir, in while managing COVID-19 itself, we used to note that Dolo 650 doesn't reduce the fever, but paracetamol crocin 500 reduces the fever. So it is all based on the bioavailability of the drug. Like a paracetamol of 650 mg might not reach the target bioavailability, whereas a paracetamol of 500 mg is able to reach. So these are the nuances which we get from clinical experience, which we incorporate in the answer, sir. And this is what is being tested also in the theory papers, rather than just what the rote memory is.
Okay, so for example, mucosal block theory.
Yes, sir.
So what practical aspect you were able to write while writing the answer this time for the question?
Yes, sir. So mucosal block theory is basically for iron supplementation, sir. We need to realize that there are two aspects of this mucosal block theory. First is that if iron load in the body itself is adequate, that is, the iron stores are adequate in the body, the intestine does not absorb the extra excess iron which is there. So it is a futile experience giving iron to such patients. How clinically we judge them is by the color of the stools or the motion passed. If it is black in color, means the iron is not being absorbed, and you can optimize the resources and give it to another patient who needs iron. Second aspect of this mucosal block theory, sir, which is more of a clinical aspect, is that both iron and calcium are absorbed by the same channel, that is the communicator into the intestine, sir. So in practice, even in the anemia Mukt Bharat Abhiyan, also in Janani Suraksha Yojana, we give iron and folic acid and calcium to the patient in the second trimester. So what happens is the mother, thinking that she's getting both supplementations, takes it together. In the end, what happens is calcium and iron are fighting against the same gate to enter into the intestine, sir. So that is another aspect of mucosal block theory which I've highlighted this time, sir.
So any of the extreme case related to this you have come across in your experiences that you had in number of years you have put in so far?
Yes, sir. So extreme cases in the sense, sir, one is we see that patients sometimes get paranoid, sir, because of the mucosal block theory. Patients develop constipation, and like I said, they have a blackish colored stools, sir, which they pass. So usually patients either stop the medicine altogether, which perpetuates the iron deficiency, or else they come to us in a very aggressive mood, telling that I came for another issue and I've now developed another complication like constipation. I've not passed stools for 3 days. These are more likely the extreme issues which I've seen, sir, regarding the mucosal block theory in clinical aspect.
Okay, that's you handle it well that way. My second question is the accountability, the legal accountability of the specialist and the gray areas.
Yes, sir.
So, are there some gray areas wherein you cannot pinpointedly say that this is falling in your account in your area and this is in my area as far as the specialist specialist job is concerned?
Yes, sir. So,
Do
sir,
we have,
sorry, sir, please continue.
yeah, yeah. Do we have such areas?
Yes, sir, definitely, sir. In fact, even in my field of post graduation, sir, I'm personally doing general medicine post graduation, where we deal with everything, including neurology, nephrology, cardiology, sir. And we have specialists for these also who exclusively deal with that. Like, there is a specialist neurologist is there, specialist cardiologists are there, specialist nephrologists are there. So the thing is that, sir, we in general medicine have a level of approach till where we are authorized to do and we are capable to do, sir. After that, even in our clinical experience, we think it's safer to seek the experience of the specialist who have a better idea regarding this. The gray area, what happens is that the specialists want to see more and more cases of their specialization, and our clinical experience decreases, sir. Just a small example, sir. I think even 2 weeks back, when I was doing my duty in the night, duty days are 36-hour shifts, sir. In the night, I got a call from the emergency ward telling a case of stroke has come. So before I could go see, the neurologist was also informed by the emergency physician, and both of us had a differing opinion of the treatment to the patient, sir. Because they wanted to do a more invasive treatment, I felt that a conservative approach might be safer. So we let the patient take the decision. In the end, we leave the consent in the patient's hands, sir. We give the pros and cons for the conservative approach, which I thought was better, and the neurologist specialist approach also. We gave the pros and cons, and we let the patient decide and give the consent as to what they wanted to do, sir. Both aspects are very positive, sir. Yeah, like, I can give the update of the patient. Now the patient is completely recovered. So we can't say that a conservative approach is bad, but to come out of this gray area, I feel that we need to empower the patient and get their consent is the best solution to come out of this issue, sir.
Okay, now I give you a case study for
Yes, sir.
this. There is a baby to be delivered through maybe normal delivery or through cesarean, and the mother's health, the so far reports of the radiologist, the ultrasound, right? These all are maintained. All the tests were conducted,
Yes, sir.
and the mother has developed, the would-be mother has developed the labor. Okay.
Hmm.
Now the baby is to be delivered in the would-be mother is in the operation theater.
Yes, sir.
Okay, so now the gynae is available. Maybe the pediatrician is also waiting, and the mother. This is the first delivery.
Hmm.
Now the accountability area, the complications are there now. In this case,
Yes, sir.
the baby who is to be given birth is in danger. Maybe the oxygen level is going down, right? The
Yes, sir.
mother's muscles, and she is not physiologically very stout.
Hmm.
So, uh, and the gynae was of the view that we will be having normal delivery.
Hmm.
And the cesarean view was also there that there may be a chance that we need to go for it as well.
Yes, sir.
The baby is to be taken out before because in some of the reports it was reflected that baby has certain, you know, lungs level problem that deficiency of oxygen may go very fatal, right? So
Yes, sir.
ECMO and all will not be handy in
Yes, sir.
such scenario. And this is also a factor to this case study that this would be mother belonging to a very high profile level, uh, ministerial level person.
Okay, sir.
So you have also this pressure.
Yes, sir.
For God's sake, it should not happen. The mother's health is in danger, and the baby's health is also in danger. Whose accountability there will be when the baby has been delivered by normal delivery and there's only 1 minute gone by when by a baby has not cried.
Yes. So, sir, this is a case of difficult labor, sir. This is very commonly seen in our setups. On the outset, sir, I want to say that the background of the patient doesn't make any difference, sir, to a treating doctor and a physician or a surgeon who's conducting an emergency, sir. For them, any patient is the same. The background, to be honest, doesn't matter at all, sir. Secondly, sir, nowadays the screening procedures have become so good, and it is not about the cost and availability, sir. It is available pan India through the National Urban and Rural Health Mission, that we are able to catch up to 99% of the complicated labor at the second trimester itself. So this should have been anticipated both by the obstetrician and the pediatrician, sir. However, there are certain instances where it is unavoidable, the 1% chance, like where sir is telling that post the delivery, the child has not cried for 1 minute. The accountability at this point lies in the hands of the pediatrician, sir, till the baby is either revived fully or has been sadly declared, sir. So the pediatrician has to take complete accountability, has to do an Apgar scoring of the child, and they will ensure that they are able to resuscitate the child, sir. The Once the delivery has happened, the onus of the mother's health is in the hands of the obstetrician, and the onus of the baby's health is in the hands of the pediatrician, sir. In case they anticipate a difficult labor, a pediatrician is consulted prior itself, before the delivery happens, and their consent is also taken regarding the post delivery complications of the child. So as soon as the delivery happens, the accountability gets split up between the pediatrician and the obstetrician, sir. A third person involved in this is the anesthetist, sir. An anesthetist is also equally accountable for both the child and the mother's health in case they need resuscitation.
So, but then in normal delivery, this anesthesia will is given or not is not given.
Yes, sir. It is not given, sir. Anesthesia is not given. However, there are increasing instances of giving epidural anesthesia before normal delivery, sir, where the labor is conducted, but labor pain is not felt by the mother, sir. This is usually done in cases where the patient has a pre-existing
But
heart.
then in the post studies conducted to this case, it was found that the deficiency oxygen level was deficient because in the normal delivery, mother was not able to give proper push.
Hmm.
And had it been a cesarean case, it should have been a very comfortable and it should have been safe for baby as well.
Yes, sir.
And because baby developed the complications and
Hmm.
that has pushed baby to the ICU. And
Ye-
uh, and there is a component of the brain, the it has developed some weakness
Yes, sir.
in the general terms.
Yes, sir.
Now the legal case has been registered.
Hmm.
Now the pediatrician is saying that baby was given birth uh, with such complications and it happened during the process of delivery.
Hmm.
But the gynae is denying all those charges and she is saying that uh, it was all fine and baby was having all the way mm, problem since beginning and
Ye-
it was natural one.
Yes, sir.
So how to pinpointedly ascertain that the problem happened during the process and all the reports were so far conducted was not reflecting anything abnormal and gynae is denying all the charges that a normal delivery stand of her was all fine.
Yes, sir. So in this case, sir, there is this document called a partogram, which is maintained when the patient goes into labor, sir. The partogram measures the contractions of the uterus. It is a very simple chart, sir. It is done in it is done in all PHCs in India, sir. Not almost, it is done in 100% of the PHCs and even in home-based newborn care, sir. It measures the uterine contraction. It measures the descent of the fetus into the cervix and the vaginal canal, sir. It also measures the dilatation of the vagina. So in this case, sir, when there is such a legal question which arises as to whom we have to say, is it because of the delivery and cesarean section could have helped, the answer lies in the partogram, sir. In case there are two lines in the partogram called an alert line and an action line, sir. So as soon as the delivery, when we are charting the descent of the fetus into the vagina, if it crosses the alert line, the PHC has to refer it to the first referral center, sir. And because it is I think what we're talking is a tertiary care center, sir, our case.
Which law is covering this episode of this case study?
um, Sir, I'm not sure about the law which is covering this episode, sir.
Now, if I talk about the institutional delivery and the deliveries, conventional deliveries at home, because of which IMR and MMR was taking place. So still the institutional delivery, sorry, the conventional form of deliveries are existing in every nook and corner of India's village. So what is the percentage of the deliveries at home?
Sir, at the All India level, sir, in the last sample registration survey, it is said that 99.3% of the deliveries happen in institutions and only 0.7% of the deliveries happen outside the institution, sir. This includes both home deliveries and deliveries in the ambulances taking the mother to the hospital, sir.
So what are the complications when delivery is at home?
So usually what we expect is that there can be postpartum hemorrhage, that is excessive bleeding post the delivery for the mother, and apart from that, puerperal sepsis, that is infection after delivery, sir. In the child, we are scared that the child might develop a neonatal tetanus because of the rural practices of putting cow dung on the umbilical cord, sir. These are the main issues. Apart from that, we are also worried about the newborn asphyxiation, sir. That is respiratory depression in the newborn.
Okay. And say, for example, the baby is accidentally delivered in flight. So what are the, you may say the gynae might have also had told, okay, you may travel, but the delivery happened accidentally. So in such scenario, what are the legal parameters that cover such delivery? Have you been means have you been taught about this aspect?
Yes, sir. Regarding international travels, if a mother does have a delivery in a flight, the newborn citizenship and the initial registrations happens in the country of arrival, sir. That is the standard precaution. However, the mother has to be informed that traveling in the third trimester, especially in the last phase of the third trimester, is completely contraindicated, sir. Usually, we notice it when there is a premature delivery, which happens in the flight due to pressure differences, sir.
Pressure differences. So
Yes.
they do maintain mandatorily the kit.
Yes, sir. All airlines are mandated to have both in the International Civil Aviation Organization's guidelines to have a basic delivery kit and a basic resuscitation kit, sir.
Oh, right, right, right. Okay. So day before yesterday, Prime Minister was talking about bioeconomy
Yes, sir.
in India. So can you update about the bioeconomy?
Sir, what the Prime Minister was speaking about was both the aspects in the involvement of renewable products in our economy, sir, especially the bioethanol and biodiesel, which he felt needed a more push for a cleaner environment, sir.
So in terms of monetary terms, what was the level he was mentioning?
Sir, I'm not sure of the intricacies, sir.
Right. Anyway, it was $150 billion.
Yes, sir.
So maybe very small number as of now, $30 billion.
Hmm.
And waste disposal is another problem in country, right? and not in country but across the world.
Yes, sir.
What are the waste which are very much, a problem for even the medical practitioner and otherwise, which cannot be disposed and which are very much fatal for the ecology and environment?
Yes, sir. So, in order of the severity, sir, I would rate nuclear waste as the most severe waste, sir, because it has a very long T half and the radiations emitted are present for a long time, sir. In fact, even in the Chernobyl reactor incident, they tell that it is going to have a radioactivity for another million years, sir. Secondly, sir, is the hospital waste management, sir. While a hospital generates about 95% of general waste, 5% is genotoxic and cytotoxic waste, sir. These have a direct effect on both the cells and the genes inside the cells, sir. So secondly it would be that, sir. Thirdly would be the chemical waste from industries, sir, and especially in that the non-point sources and the point sources, sir. So these three would be the main issues of waste which are present in India. There are several guidelines regarding the waste disposal separately for the three, sir. One is the nuclear waste have a separate guidelines under the nuclear code. We have a biomedical waste act is there, biomedical waste rules are there, sorry, and for industrial hazardous waste are all a separate rule is there, sir.
Okay. Which article is connected to the waste disposal of Indian Constitution article?
Sir, it will come under the DPSP, sir, but I'm not sure of the exact article inside that, sir. I think it is Article 48A, which regards to the environment, sir, having a clean environment, but I'm not able to pinpoint the article, sir.
So the waste management and the role of human, if we talk about any fundamental right is coming in touch with it.
Sir, one is Article 21, sir, that is right to life and clean environment. And inside that, there can be a right to clean environment, sir.
But then 17 also.
Uh, yes, sir, but 17 is more regarding untouchability, no, sir, rather than directly linking to waste.
So the most inhuman part, as far as its human role is concerned, for the waste disposal and as well as cleaning the the gutters and
Yes.
the
Mhm.
so do you think that Article 17, which is abolition of untouchability,
Yes,
as well
sir.
as Article 15, clause clause B and C, uh, so eradication of untouchability
And
is
manual
coming very
therapy.
close to the waste disposal management, and
Yes, sir.
I find that at the core, segregation of waste, if it happens properly, then half of the problem solved there itself.
Yes,
You
sir.
have made the color code also, as
Yes, sir.
far as the dustbins are concerned, but hardly people are aware, and even if they are aware, then they are not following it.
Yes, sir. But sir, several municipal corporations across India have made it mandatory to have a segregated waste when the corporation workers do come and collect. But in the rural system, it is still not yet implemented, sir. In the sense, more in spirit, and people are not following it to the letter, sir.
Yes. And when we talk about some of the movies made for waste disposal chain, can you name a few?
Sir, off the top of my head, I'm not able to
Article
pinpoint.
15 itself uh,
Yes,
reflected about this,
yes, sir.
the death of the human municipality workers.
Okay, sir.
And as an IAS, if you have been given responsibility of municipality, so how will you be able to solve this problem effectively when it comes to the role of human and effectiveness as far as the disposal is concerned?
Yes, sir. So, first of all, sir, we have a system in place, sir. The implementation is what is lacking. So, I would want to first take a stakeholder approach as to where the lacuna is and why the system is not working correctly. post which I want to get ideas from everybody on like from the stakeholders. I want to get their ideas, and my idea would be to empower the citizens and increase awareness amongst them regarding the importance of waste disposal, and the importance from the point of the waste collectors, sir. Like there are so many incidents of people getting infections and skin allergies because they are having to segregate waste instead of it being just segregated at the point of generation, sir. So apart from this, I will want to make it a bit more public in the sense that I would want to have a campaign, and I would want to have a catch line and catch slogan, just like how the Swachh Bharat Abhiyan had, in a more regional and a local way, so that the people are able to identify. Like we can have there are case studies where the waste collectors play music on the same day at the same time, so that people are immediately alert that the waste collector has come. We can give the waste, we can keep the waste in the front of the house. These are all very intuitive ways which we can increase the turnaround of waste collection, sir.
But then apart from this, what are the medical intervention that you will, because you are updated with it and your background will help the
Yes.
administration more, uh, some of the chemicals which are required, some of the chemicals which are, helping the in situ degradation of some of the, waste. And then there is something, maybe potassium permanganate.
Is a
Have you heard
disinfectant.
about this chemical agent?
Yes, sir. It is a very potent disinfectant, sir. It is being currently used by several municipal waste collectors also. Apart from that, sir, we can also include chlorination drives for the waste which are collected at a point at a common source, sir. We can instead of because chlorinated bags were very common, sir. However, it was found to be that it causes some amount of environmental issues also. But chlorine has its own benefits also. We can have a common chlorinated pit where we can put a lot of waste. Same way, sir, like sir mentioned, potassium permanganate is a very potent disinfectant. If we can just spray potassium permanganate solution over the waste, it will also lead to decreased spread of infection from the waste, sir. And apart from that, sir, since you asked interventions from the medical side, I would want to have a very foolproof personal protective equipment kit for the waste collectors, sir. Even in my locality, when I see people collecting waste, they are generally not having any personal protective equipment. They don't wear gloves. They we give it in a bag, so they are able to take it in a bag, sir. But that is not the case in every society. People just throw the waste in a single dustbin and keep it, sir. So personal protective equipment also is what I feel is very important for the waste collectors, sir.
For example, the menstrual pad, which are thrown freely without uh, observing any precaution. So, what type of hazard it imposes specifically if I talk about the menstrual used pad?
Yes, sir. Sir, blood per se is a source of infection, sir, in that it is a very viable medium for all infections to grow. Apart from that, sir, the sexually transmitted diseases can be transmitted through handling of these menstrual pads, sir. Not per se HIV, but other sexually transmitted infections like gonorrhea or herpes can transmit through these infected pads, sir. However, there is the increasing use of medicated pads, sir, which have an automatic antibacterial and antimicrobial effect in them. Even the pads which government gives, sir, which is the 1 rupee pad, also has some amount of antimicrobial activity in them. But this is not a caveat for people throwing the menstrual pads in no, common dustbins, sir. They need to be segregated, and they need to be thrown in the red color bin, which is usually provided for the hazardous waste and medical waste, sir.
But don't you think that if we provide the pad size polythene, wherein it is written that you have to just pack it again and it is sealed, and then it is thrown in any of the bag, right? And it has been designed in such a way that it is not mixing up. The agent who is segregating the waste also is having also comfortness. You are getting my point. So,
I,
and
I
if even if it is lying anywhere in that bag, it is not imposing any problem.
Yes, sir. This is a very valid point, sir, and it has been done by several NGOs, sir. Off the top of my mind, I can remember an NGO called Hand in
Even
Hand.
we talk about the corporate companies which are
Yes,
making it and selling it in the market, they
yes,
are
sir.
not doing it. And
Yes,
they
sir.
can do it very well, and it can be part of the cost of the package. And
Yes, sir.
people are happy to pay it. And
Yes, sir.
every nook and corner, everyone and every female member of society is finding, and they are handicapped because the provision is not available, then they are not able to observe it.
Yes, sir.
And if per se, if we need to design one of the polythene like this, what type of chemical we will be using in such polythene or bag, which is, uh, you may say, insulating it or biodegrading it within itself, and what are the other things, you may tell it better.
Yes, sir. So, sir, what has been tried and tested is, like I told, the chlorine lined bags, sir. These chlorine has this antiseptic and antimicrobial effect, which prevents any organism growing in the menstrual waste, sir. Apart from that, we can have sodium hypochlorite crystals, sir. These are basically blood disinfectants. They are used when there is a blood spill in a hospital also, and there have been NGOs like which I was mentioning, Hand in Hand, sir, which is a famous NGO in south of India.
Yes.
They use the sodium hypochlorite balls inside these disposable packets of menstrual pads, which are distributed free of cost by the NGO, sir. Apart from that, we can also have alcohol-based disinfectant-lined pads for disposal of these menstrual pads, sir.
No, this hand in hand, if you may read, that they have conducted studies and also quantified the implications of such things, and they have started making the bags for the
Yes.
used pets.
Yes, sir. That was the case study I was also mentioning about, sir. That Hand in Hand has provided these menstrual disposal bags, sir.
So maybe they will be integrating it with the corporate companies which are providing it.
Definitely, sir. And this should be a step in the forward, sir. And this can also be included in the extended producer responsibility criteria for menstrual pad generators, sir.
Right. Now, if I need to talk about the hobbies part of yours, you have mentioned about a new hobby, that is to begin with comparing.
Yes,
Could
sir.
you enlighten us about it?
Yes, sir. So I started off with amateur comparing, sir, where I used to compare several of the events organized by our medical college and our department, sir. But slowly, people were able to recognize my comparing skills, and I even got a few chances to work in Doordarshan to compare certain TV shows, sir. Mainly, there were only two types of TV show. One where I was hosting another doctor and I was asking questions regarding the need for health awareness in the public, and second one was a more tourism based show where I would be comparing a tourism show and explaining the places which were shown in the TV show, sir. Both were more of a amateur comparing rather than a professional job, sir.
Right. So, how will you be using this hobby of yours in the days to come if you are selected and serving as an administrator?
Yes, sir. So what I realized very soon when I started comparing is that I had to develop the skill of catching the audience attention, sir, and having them involved in the event throughout, sir. Because audience have a very short attention span, and they tend to move towards their phone or see or talk amongst themselves, and the main topic is not conveyed to the audience. So I feel this aspect of grabbing the people's attention and ensuring that they understand and the message gets delivered to them will be of great help for me while creating more awareness regarding the policies, sir.
Okay, good. So, new health policy, if you need to compare, which is that country you would like to make it a reference point for India's new health policy, national health policy?
Yes, sir. So, sir, while there are several issues in Indian health, I find that out-of-pocket expenditure is the primary barrier for Indian health, sir. It has come down from 67 to 39%, and the trade and the what we say as the pole-bearer of out-of-pocket expenditure reduction was the National Health Service of United Kingdom, sir. They have practically made healthcare free. It is not without any drawbacks at the National Health Service, but that can be the pole star for our new health policy also, sir.
There are two countries I will like to mention. That one is Australia, and another country is Japan. So, what is so special about their medical policy, which may not be part of India's national health policy? If you
Ye-
have might have studied those policies.
Yes, sir. While I have a general idea of both, sir, I will mention what I found very interesting in both their health policies, sir. First, regarding Australia, is their emergency services, sir. They what was very enticing in that was that they have a system where a doctor, a nurse in an ambulance can reach any point in Australia in within 90 seconds of an emergency call being given, sir. And this has been tried and tested several times in Australia. They have yearly mocks also, and this happens on a regular basis, sir. This is what really enticed me in Australia. And in Japan, sir, it is the screening policy, sir. They have a very early screening system for mainly cancers, sir. Cancers and non-communicable diseases. They have a very early screening system which starts even as young as 5 years of age, sir. While there are several other benefits to both of their health policies, I find these two to be very interesting aspects of the health system, which can definitely and needs to be definitely replicated in India, sir.
Okay, but if I connect medical tourism, then which country has such features called as medical tourism?
Sir, medical tourism, while India is still considered to be the prime destination for medical tourism, sir, like sir mentioned, Australia is also very famous for medical tourism, but more in line of the non-communicable diseases. In India, medical tourism, and especially in major cities like Chennai, Bangalore, and Mumbai, our medical tourism is very good in terms of both communicable and non-communicable diseases, and especially advanced cancers, sir.
But reasonableness in terms of the money spent, is Australia better or India is better?
Sir, comparing eye to eye, definitely India is more reasonable in the services, the cost per service, sir, and even the range of services. India is definitely better than Australia, sir.
But I have heard that if some of the cases that detected in Australia after reaching there, then government will be sponsoring and giving all money spent in that medical line or medical
Yes,
stream.
yes, sir. This is one of the features of their rare disease policies, sir. But again, sir, we have to have an idea as
Arvind, are you there? Ekansh, are you there? Okay, I think there was some problem.
yes, sir.
Okay, so we were talking about the
Rare diseases which the Australian government is able to sponsor, sir, if it is diagnosed in Australia.
okay.
Yes, sir. So, like I was stressing on the point, sir, that rare diseases do happen, but in a country like India, which has such a high population burden, and they are also open to tourists from South Asia and Southeast Asia for medical tourism per se. We also have. I find that comparing both, treating a large number of diseases which can be cured has a better advantage, sir, and we have a very cheaper rate compared to Australia India for treatment of communicable and non-communicable diseases which are common. Regarding the rare diseases, sir, India also has a national rare disease policy where we have categorized it into three types, and the first two types India has a rare disease fund itself, sir. And the third type we are able to, which are very rare diseases, and there is only palliative care which is possible. We have a crowdfunding mechanism for funding those diseases also, sir.
Right, right. But basically, these are the policies that government of India make. But because demand is huge and population is also more, they are not able to cater the need. But in Australia, by and large, it is a controlled case of population, number one, and then negative growth of population is also there in some of the areas.
Yes, sir.
So then demand is, of course, comparatively less. So we are able
Yes.
to, but it is noticeable and it is deliverable.
Yes, sir.
But in case of Japan, you told about the early detection of
Yes, sir.
early stage detection of the cancer. But what is so special about the old people care as far as the medicals are concerned in Japan?
Yes, yes, so Japan had one of the earliest cases of aging population, sir. So what they did was they have a specific old age policy which is there for the older age group with insurance induced care, sir. They are also able to provide very good palliative and hospice care, sir, for Japanese old age, where a whole of service approach is provided to the old age people, where they are able to obtain care for both treatable diseases and non-treatable diseases like diabetes and hypertension, sir. Again, sir, why I did not mention that as a very stark feature is because just recently, I think last October, the Honorable Prime Minister has widened the Ayushman Bharat insurance into all of above 70 years age group, sir, with the double insurance also. If they are in a in that select socio-economic category and they already have Ayushman Bharat cover, they get an additional 5 lakhs for the above, for being above 70 years of age, sir. Hence, I did not highlight this part, but yes, sir, Japan is definitely one of the pioneers in hospice and palliative care, sir.
So this is a model that India can have it as a reference point in the world also. Japan is the the place wherein olds are given a lot of respect, care, medical
Yes,
care, and government is looking after them exclusively.
yes, sir.
But not on papers, but actually it has it has become a system.
Yes, sir.
So that is one thing. Okay, so apart from comparing, the medical research is also one of your favorite area.
Yes, sir.
So in China, some virus was detected, and some
Yes,
case was also detected in India.
yes, sir.
So what is the future precautionary measures that you can give as a medical advisor?
Yes, sir. So, first of all, sir, regarding this new virus, which is the human metapneumovirus, it has been there. Even the Ministry of Health and Family Welfare has put out a document telling it has been there since 2001, and it was initially found in the Netherlands, sir. I would just like to give a small example, sir, of 10 seconds. Like when I was doing my internship in pediatric ICU, there was this one a child of 3 years who developed fever, and it turned out to be human metapneumovirus in the year 2020 itself, because we did a whole viral panel. And in fact, I was astonished to see that my professors were all relaxed that it was human metapneumovirus and not a deadlier virus like rotavirus or corona, which was there at that time, sir. So this is the level of awareness which doctors have, and they are pretty confident about this disease being a mild disease. Hence, we need to ensure that even in future cases when we are dealing with such outbreaks, the people need to be cautious, but they don't need to panic, sir, because panic is something which has happened now because of the social media echo chambers and fake news which spread very commonly. Definitely people need to be aware of new viruses, new outbreaks which happen all across the world. It helps us to in early detection and stemming the spread of viruses and bacteria also, but there is
Any
no need.
chance, sorry to interrupt, any chance uh, we may have a situation like, for God's sake, it should not happen in 2020?
Sir, regarding this human metapneumovirus, the chances is very low, sir. But
I mean,
there is all.
not about this virus,
Yes, sir.
but
In general.
have we geared up well because of the corona imposed problems, or
Yes.
there can be next level problem also?
Yes, sir. So, sir, like this, till coronavirus was the bottom, sir, because it was an RNA virus. It was the deadliest that could be possible because of the mutagenicity of the virus, sir. It was changing every 2 to 3 months. The symptoms were different when we used to see the cases. We have both a robust system of surveillance, sir, through ICDS, that is integrated integrated disease surveillance policy, IDSP, sir. And we have a robust primary health system also, which is very well equipped to identify the disease as soon as an outbreak is noted and an endemic turns into an epidemic. The international level, we have the whole issue of syndrome X, which has been touted by WHO, where there is an action plan of developing a vaccine within the 100 days of an outbreak if anything does happen, sir.
But then again, there are legal parameters. In Corona time, also we had to relax, and we have to take a what is called as calculated risk. So we will be doing it in future also if sometimes things are required.
Yes, sir.
Also, see, if IPS and IAS, they are to be given certain vaccines for the services they are in. So what is that vaccine which is given to an IPS but not to an IAS?
Sir, I'm not exactly sure, sir, of which is given to IPS and not IAS. But in general, sir, people who are exposed in general, they are given an rabies vaccination before the exposure of rabies, sir. But in particular, I'm not able to recollect, sir.
Uh, You know that the uh, mm, the living in the forest areas and combat operations, if some of the poisonous insect bite, the snakes bite, which is more in terms of the profession, the work that the IPS is undertaking. So that is why some of the extra vaccines are given. You may recheck it
Yes,
again.
sir. Sure, sir.
And in the cricket match also, some of the peculiar medical understanding has been developed so far. Can you just, in short, tell about two, three medical understanding, especially to cater the people who are suffering? For example, Sachin Tendulkar, every cricketer is having. So you
Yes,
may
sir.
tell about two, three episodes connected to cricket.
Yes, sir. So, like sir pointed out regarding Sachin Tendulkar, Mr. Sachin Tendulkar had this issue of the tennis elbow, sir, which is basically medial epicondylitis. It is the inflammation of the common origin of muscles, sir, because of which he was not able to play the drive for about 6 months, and he had actually taken rehabilitation for that. Apart from that, sir, post the unfortunate death of Mr. Philip Hughes, who was a famous Australian cricketer, post the ball which hit his head and there was a subarachnoid hemorrhage, there has been this new rule of concussion substitutes, sir. So concussion initially was not taken lightly was taken lightly in cricket, in that it was just the cricketer vomits and then he becomes better, so he starts playing again. But now there is a mandatory rule that in case concussion is diagnosed, the player has to be substituted with a like player of a similar talent, sir. Apart from that, sir, in cricket there is this common thing of the hamstring pull, which is basically a sprain of the hamstring, sir, which happens when cricketers are playing for a long time, especially the fast bowlers, sir. And apart from that, lower back spasms and muscle tears are very common, which have become a common parlance. Even recently, Mr. Jasprit Bumrah was diagnosed to have a lower back spasm, which could have been a grade 1 muscle tear. And apart from that, sir, there is always this issue of stress fracture. However, it is not a new thing. It has been there since the times of Mr. Kapil Dev, and even Anil Kumble had a stress fracture. But these are all the common medical terms which have become common parlance because they are very famous in cricket, sir.
Who is designated medical consultant as of now for cricket, India's cricket team?
Sir, I'm not sure of the name, sir. I'll look up, sir.
Right. And if the Indian cricket team is going to a place, for example, South Africa, where the temperature is very soaring, and some of the extra diet plan, as well as some of the skin care, as well as uh, for improving the resiliency while playing, the medical consultant is advising something which is, you may say, preventing dehydration and other complications so that they are not going out of energy. So, with the common sense that you may have as a doctor, what can be the advisable things?
Yes, sir. So first of all, sir, because we were speaking in specific about South Africa, which is being in the southern hemisphere, there is a high exposure to UV rays. Hence, we obviously need to have a complete sun protection, which is there using sunscreen, sir. Ideally, what we recommend for cricketers is an SPF 50 with 4 plus, sir. That is UV A, B, and C protection. Apart from that, sir, the best I always tell everybody that the best way to rehydrate is with water only and not through these ionized drinks or excess energy drinks, sir, because they tend to have a issue regarding the balance in
And as far as food is concerned,
Yes, sir. So food, sir, we need to reduce the fat content of the food and increase the ketone content of the food, sir, because ketones have a longer period, a longer energy sustenance period. It will ensure that cramps also decrease, which players usually have when they play for a longer period of time, and they will stay hydrated and energized, sir.
right. But when they are given rice water, the water retention in body is more
Yes, sir.
to the
And
patient. To the
yes, sir.
patient also we give. So rice water is one of that advisable thing
Yes, sir.
wherein they can withstand that temperature without
Yes,
upsetting not only their stomach but otherwise too.
sure, sir.
Right. So this is the basically every continental play they have a change in diet.
Yes, sir.
Yeah. So you have been best outgoing student of the college.
Yes, sir.
In which specific area?
Sir, so the in my undergraduate college, the best outgoing candidate is being evaluated on a certain parameters, including academic excellence, then participation in extracurricular activities, participation in sports, sir. So when the dean did decide to give, they usually have a criteria and they tell why a candidate was chosen, so that transparency is maintained, sir. So apart from getting certain medals of distinction, I played in the cricket team for 5 continuous years, sir. I was the two down batsman in the team. Apart from that, I have also ensured that awareness in public and in the people who used to attend our hospital through acting in swine flu advertisements, sir. Basically, these are all short plays which are videographed and televised in the hospital premises for greater awareness on how swine flu spreads, and even we did once post the coronavirus also, sir. So these were the main criteria which they said before they were able to tell that I was the best outgoing student, sir.
That's good. And 7 medals of distinction in MBBS.
Yes, sir.
So which medal aspire you aspire the most?
Sir, to be honest, it was the one in pulmonology, sir, because it aligns the closest to my post graduation field also. However, apart from that, sir, every medal is close to my heart, sir, and obviously the first medal is also very special to me, sir.
Okay. And you have been part of the organizing committee also for a medical conference.
Yes, sir.
That's good. Any international conference related to the medical practices conducted recently?
Yes, sir. I think a year ago, the WHO conference for Indian medicine and alternative medicine was held in Gujarat, sir. Gujarat, sir. Apart from that, there is this yearly international conference of the Association of Physicians of India, which is going to be held in 2 weeks' time, sir.
Right. So, Arvind, your formal mock is over.
Thank you, sir.
So, what feeling you have about this performance?
Yes, sir. So I just feel in the initial parts, I was also taken aback by the depth in the medical questions, sir, because I was generally preparing for a more of a balanced thing. But then that was a good thing which I felt, sir. I was like, I have done one trial run with you regarding the in-depth medical case scenarios and the legal aspects, which I'll definitely go and look up, sir. Apart from that, yes sir, it was like most of the questions were from the new areas which I have just gone through, but I've not had a structured answer, so I'll work on that also, sir.
And don't worry. So maybe there are five people, and definitely, if we are giving deepness to something, it will be having more colors.
Yes sir.
Uh, but yes, I will say that when we are giving the answer, so first line may be about the core of the answers,
Okay sir.
and after hearing about the core, then they will be switching to another answer.
Okay sir.
And there are chances when we are talking about the core, when what actually the honorable member want to listen, then uh, they go for another question.
Hmm.
And sometimes it happens that in 15 minutes or 20 minutes time, in whole interview is over.
Hmm. Yes sir.
Okay. So I will say ki in the first line, the core is to be told.
Okay sir.
And then the forward and backward linkages can be there.
Yes sir.
Sometimes what happens as a human, we may say we are not saying no to any answer because we know it, but we are formatting this sentence in our mind. We are
Hmm.
recollecting also the sharpness about the answer. So we end up in starting with the peripheral part of the
Hmm.
answer. So
Yes sir.
starting the peripheral part of the answer and then reaching the core, right? Then I think we should go otherwise. First about the core,
Hmm.
that may be over in sometimes 4 or 5 words, and then peripheral part can be touched.
Yes sir.
And it is just common sensely you can gauge the face of the member, that if they want to hear it more, then you
Hmm.
can definitely go about it,
Yes sir.
right? And second thing is voice modulation.
Hmm.
Voice modulation. So, so for example, the kind of tone and toner you are having, uh, there may be a different tone and toner at uh, a point of day, in the morning, in the evening.
Hmm.
So when we have a, a kind of serious tone
Hmm.
relatively, then it may impact better, or it may
Okay.
impact more.
Hmm.
Right. So what other friends of yours before going to the interview board, they are having these straps,
Hmm.
that candy
Yes sir.
to have a clear throat, so that
Hmm.
voice is also clear.
Okay sir.
So, and uh, Patanjali's, I think something is there that I was also having
Yes sir.
sometimes. So that way, what you may try voice modulation. You
Hmm.
just practice it that way, that which voice is going better with you
Okay.
at your own. And you may take advice of your mother, father, that's it.
Yes sir.
Just which voice is better.
Yes.
Sometimes you might have heard Lata Mangeshkar when she
Hmm.
talks and when she sings,
Yes.
totally different.
Yes sir.
Totally different.
Hmm.
So you may go for it as well. These are the two things I am finding. Other things we have already advised. You have worked upon them very well.
Okay sir.
So I feel that you will be getting very good marks.
Thank you sir.
And last time we talked about your father's profession and things. That's why I did not touch it.
Yes sir. Yes sir.
And because you are already prepared well for it. And
Yes.
also for the question that if you are becoming doctor, why are you becoming an administrator?
Yes
I
sir.
have given you ample areas wherein you can mention that
Yes sir.
as a doctor, I can become DMO and maybe next to that. But as medical advisor, right, for the policy, I it is possible only after becoming, you may say,
Yes.
IAS or an administrator.
Hmm.
Because we have already selected one, so they may say it that way. So this is the pinpointed answer that you should give, that
Yes.
I will be becoming as a medical practitioner, DMO or like that,
Hmm.
and other services may not be able to use me that well. But in
Yes.
administration, definitely, I'll be going for the policy formulation, which will be impacting lakhs of people. I'll try my level best that way.
Yes sir. Hmm.
And So this is what we have. Any other thing you want to ask?
Yes, sir. Only one last question from my side, sir. In that, like, sir knows in 2022, I had cleared and I was recommended for the IRMS, sir. That is Railway Management Services.
Yeah.
But the truthful and honest reason why I didn't join was that I realized that in every subject I needed about 20 marks to study, and within 3 months it wouldn't have been possible because if I wrote the prelims again, so I had three more attempts. I was anyways bound to write another attempt like any other person would. So I decided that I'll just take a break here. I'll not write the 23 exam. I'll write 24. And in the meantime, my PG should would also be completed, sir. So my exams would be in June, July. So by the time the results are out, probably my exam is over itself, sir. My PG exam is over also. So this is the honest reason, sir. But what I am planning to tell, in case they ask you why you didn't select the service, is that I had three more attempts. It's a very prestigious service. I'm humbled to have been recommended for it, but I had three more attempts, and I was planning to write another attempt. Hence, I did not join the services. Is what I'm planning to tell, sir. Not going too much into the intricacies regarding the marks and all.
Uh, Actually, the concern is itself having many dimension. You try to include it everything. I
Yes, sir.
think simplify it more. Uh,
Yes.
you may say, "Sir, I was selected for it, but there were some. First, there was a window for this leave that I can take. Then, second thing was about the continuation of my degree that I thought that let me complete it. Then second thing, the third thing was that I just wanted to give the exam again so that I can have the administrative service,
Okay,
right?
sir.
Administrative service. So for two primary reasons, coming through the facilitatory, the window of the leave that I got, I was able to have it. So I'm comfortably giving this attempt, as well as I also completed the ongoing medical. You were
Oh, sir.
doing it, na, at that
Yes,
time
sir.
earlier.
That time itself, I was doing it, sir.
So you may say, sir, I just wanted to give this exam sincerely, and I wanted to prepare for some of these specific areas. That is why I took this route,
Yes, sir.
right? So they
Yes.
will be saying that this is also a very good service.
Hmm.
You may tell honestly, sir, because uh, I will be able to contribute better as an
Hmm.
administrator, and also I will be able to secure the larger areas.
Okay.
Then they will be saying, laughing on your answer. Uh,
Hmm.
but then this and that. Then lastly, if you may say, sir, after becoming an IAS, more chances are there that I will be becoming an advisor at
Hmm.
that level and contributing to the policy.
Hmm.
So that way they will be taking it well because everyone is knowing that everyone is trying for an IAS and
Yes, sir.
All India service.
Hmm.
So how you beautifully you justify
Hmm.
how beautifully you justify. One of the girl was there. She was in RBI grade B, and we told that you get a lot of money in this, and half of the money you will be getting as an IAS if you are there. So she beautifully handled it that way that I will be becoming only deputy governor at best at uh, if I go with this job. But if I'm an IAS, I'll be becoming governor of RBI.
Hmm.
So how you handle it. It's not
Yes.
only this way that I have told, any number of way you may think.
Yes, sir. Sure,
But
sir.
very simple and very short,
Yes, sir. Understood, sir.
right?
Yes, sir.
So, right, Arvind, you may connect anytime for any of the additional things.
Thank you so
For
much, sir.
now, it was wonderful performance. I wish you all the very best. This time, you should make it in the very desirable place in top 50 at
Thank
least.
you, sir. Thank you so much, sir. Thank you for your
All
time,
the
sir.
very best.